Congressman Bacon, many Americans are struggling with the rising cost of health care. In your first 2 years in the House, the Republican-led Congress has not made substantive changes to the health care system. Why should voters who are concerned about this issue give you another chance?
Well, thank you very much, Craig and Michael and Kara. We did vote about a year ago to lower premiums by 20 to 30% by changing the structure of how the insurance, the pool structure, we'll say it that way. So we modified the pool structure. We also provided the chance to get generic drugs quicker on the market. We've done various reforms out of the House, but could not get them through the Senate. I support legislation that will change the pool structure, that will reduce the premiums by 20 and 30%. I want to get generic drugs on the market faster so we can get more competition on that side. We have also supported associational pools that will allow farmers and small businesses to pool together so they're not by themselves. But I do not support a federal government takeover of healthcare that costs $32 trillion, that would take away the healthcare for those who actually like their healthcare and will double the federal tax burden.
Ms. Eastman, you've made single-payer healthcare system a priority, or Medicare for all, as some call it. It's the centerpiece of your campaign. How would you pay for the plan?
So the interesting thing about healthcare right now, and actually the devastating thing, is the cost. The federal government is projected to spend over $50 trillion over the next decade in healthcare. A system like Medicare for All has actually been proven that it would save the federal government money. And the best thing is it provides health care to every American citizen. We have far too many people in this district who are struggling and having to choose between paying their prescription drugs, paying for health care, and putting food on the table. And unfortunately, Congressman Bacon voted for a health care bill that takes away health care from over 24 million Americans. We need somebody who's going to stand up and fight for health care, for an affordable system that works for everybody.
May I respond?
Yes, you can.
We did vote for health care that would lower premiums by 20 and 30%. We did take away the mandate, so folks had that decision or that freedom to make that decision. But the story that Medicare for All or a government takeover saves money, Washington Post gave that 3 Pinocchios. It's actually $32 trillion. It would double the federal tax burden. So today the federal government takes in 19 cents on every dollar, would be 38 cents on every dollar. While state and local government, 56 cents on every dollar would be spent towards some form of level of government. That is not America.
All right, we have 2 more health care questions, and Ms. Eastman, this is for you. Your plan would mean that everyone would get their health care through government-run benefits, a system. What would you say to people who like their current plan, their health care coverage, and want to keep that plan?
So first of all, I think we have to be clear about what this system is, and this is a government-funded plan that is privately operated and delivered. So Americans would still have a choice. Now, Medicare for All to some people seems like a more pie-in-the-sky system, although I do believe that as Americans we all deserve high-quality health care. But there are options in front of us right now, like a public option for prescription drugs, or an option to opt into Medicare so that people who have employer-sponsored health care coverage could keep it. However, I think we need to look at the economic burden that employer-sponsored health care has on small businesses and even on large corporations, and the fact that we have young people in this country, older people in this country, choosing to their career based on their health care benefits. That's not in pursuit of the American dream, and that's not who we are as Americans.
Next question is for Congressman Bacon. You said you support protections for pre-existing conditions. How do you square that with your support with the waiver states they can pursue? What would you say your coverage makes it more difficult to obtain in some states?
In the AHCA that I voted for, it was written right in the bill that pre-existing conditions would be protected. You couldn't be discriminated against for any type of pre-existing condition. And because of all the criticisms and demagoguery, we added an amendment that said the same thing. But we had 2 amendments that we added in there. One of them was that if a state had a better way to do health care, innovation, that they could propose it to DHS, and if it didn't violate pre-existing conditions, it still provided a good level of care, that they could grant that waiver, because we know states can innovate. And the federal government does not have all the solutions. We also had an amendment that said that if someone was not on insurance and refused insurance, but then needed the insurance, and then would come back off, that you'd be penalized, because we need to hold people accountable for gaming the system. Both of those amendments, Nancy Pelosi and the Democrats said were attacks on pre-existing conditions. I don't think they were. They're written twice in the bill and in an amendment protecting pre-existing conditions.
All right, next topic, taxes in the budget. Congressman,
do I not get to respond back to that?
If you've got something to say about pre-existing conditions,
I
sure.
do, absolutely.
Okay.
And I think this is where the Congressman needs to be clear. His vote of hell yes to repeal the Affordable Care Act meant that states would be allowed to charge more for people with pre-existing conditions. And I'm tired of listening to this rhetoric of, the Democrats or, Nancy Pelosi. No, this is an issue of Americans being American and making sure that we are providing health care coverage to people and being honest about the policies that we lay out in front of them.